Dr. Alan Christensen here. You know, there's very few things that can take more away from the enjoyment and the experience of our lives than chronic pain can. It does so much more even than we realize in the immediate moment. Our brain has a certain amount of voltage that it uses, actually not a lot more than a common battery, and it's got a finite amount to work with. And that voltage can spark our creativity, our happiness, it can move our muscles. When we have pain, that's quite literally a short circuit in that system. So it's a large number of volts that you don't get to do fun things with. So not only is pain a nuisance and a pain, as we say it, but it's taking so much away from our vitality. When there are chronic issues, one of the biggest reasons for that is that our body doesn't have proper alignment and proper planes of movement. You'll hear about this in terms of our skeleton, and it does happen that your back can get out of place. You can get pinched nerves, you can get skeletal misalignment. But think about this. You know, the proverbial skeleton in the closet, it doesn't get misaligned, right? It's just there. It's really the active tissues that allow for movement and attach the skeleton to itself that are the big reasons why we tend to have chronic pain or instability or chronic dysfunction in the body. And those structures would be our muscles, our tendons, and our ligaments. So for sure, when things are bad, the skeleton can get misaligned, we can get pressure on key nerves, and we can have pain from that. But the misalignment itself is really the core of the issue. At Integrative Health, we're very excited to offer therapies that regenerate those connective tissues. So tendons and ligaments, they're often the big parts of it. They hold muscles onto bones and bones onto bones. Most cases when we have physical trauma, what happens is those structures, they get yanked and they get stretched. They become too long and they can't allow your body to move in the proper motions. And that means we get pressure on the nerve. It also means we could hurt the cartilage inside of a joint. Cartilage doesn't randomly wear down, it wears down when the joint's not moving at the right angles. With regenerative therapies, our doctors use your cells that grow new tissues and use those cells of yours to create healthier, stronger tendons and ligaments. There's compounds that circulate in your body constantly that allow you to heal up a cut or a wound. And those compounds are called platelet-derived growth factors. And those compounds are taken from your blood and concentrated and then put wherever there are ligaments or tendons that aren't working properly. And that means your back stays lined up, it means that chronic inflammation is reduced, and it means chronic tendinitis can go away. This is radically effective for those that may need knee replacement surgery. We'll commonly see knee cartilage thicken by a factor of 1/4 of an inch to 1/2 of an inch in just a few months with your own cartilage that you get to keep, which is so cool. So yeah, chronic back issues as well. Back pain, as common as it is, it's actually a huge mystery in medicine. People that have had disc issues or herniations or impingements are actually not more likely to have back pain than those that have no issues that show up on their back. So what we have learned though is that the small ligaments and tendons that align the back are the biggest factors in keeping it healthy. And they can be healed, they can get healthy again. So like all areas of your health, never give up on things and never think you're stuck with chronic symptoms. Your body can heal given the right circumstances.